Hello, Mr. Joshi. Thank you for joining us today and taking out the time to speak with us. Today's topic is going to be borderline personality disorder. So I'm just going to go ahead and introduce Mr. Joshi to everyone. Mr. Rohan Joshi is an educator by training and profession with a deep interest in mental health, especially in the Indian context. Mental health issues, especially personality disorders, are rampant and yet vastly unaddressed. Borderline personality disorder is one of them. Mr. Joshi engages with groups and individuals to inform and educate them about mental health issues, provide initial counseling on help options, and in select cases also supports them in their process of recovery. In the US, somebody like Mr. Joshi would be considered a mental health social worker or mental health counselor. So thank you once again for joining us today. I'm
Thanks,
going to
Maria.
quickly start off. We want to just understand what borderline personality disorder actually is. So
Mhm.
could you just talk to us a little bit about that?
Sure, sure. So, thanks, Navya, for inviting me here and really happy to talk to you. I really appreciate the work you guys are doing because I think it's really important in the Indian context currently to talk about mental health and also actively support people who have different mental health conditions. In the
Yes.
last few months, we have particularly seen that the health issues have come to the fore, and many people are still not aware of the treatment options, how the recovery looks like.
Yes.
Particularly in case of borderline personality disorder, but vastly about other mental health conditions as well. So in this
Yes.
context, the work you're doing is phenomenal. So congratulations and
Thank you
all
so
the
much.
best for your work.
Thank
As
you.
far as borderline personality disorder is concerned, it's one of the more complex mental health issues or mental illnesses, which
Right.
is vastly misunderstood in India as well as globally. There are
Okay.
many reasons for this. So I'm going to explain this borderline personality disorders in two parts. One
Okay.
is how do you diagnose somebody with borderline personality disorder, and what is
Right.
the lived experience of somebody who has borderline personality disorder.
Okay.
So
Amazing.
these two differ a little bit, as you can understand.
Okay.
So borderline personality disorder primarily is characterized by around 9 different symptoms.
Okay.
The core symptom is essentially very difficult interpersonal relationships and a fear of abandonment.
Right.
These are, in a way, telltale signs of borderline personality disorder. Having said that, there are 7 other symptoms that we look out for.
Right.
One is tendency to self harm. It
Okay.
includes suicidal ideation and active suicide attempts.
Okay.
If you look at the successful suicide attempts and track back their mental health history,
Right.
you'll find a high correlation between borderline personality disorder and active successful suicide attempts,
Okay.
as well as failed suicide attempts or entry into psychiatric wards to seek support. Borderline personality disorder very highly represented in those.
Okay.
Then we also have something we call disassociation or losing touch with reality. That's
Right.
another important sign or symptom of borderline personality disorder. And in stressful situations, being sort of symptoms that resemble psychosis are
Okay.
also commonly seen among people with borderline personality disorder.
Okay.
Substance abuse or maladaptive coping mechanisms is something that we have seen, or in general, there are overall 9 different symptoms, and out of which, if a person meets any 5 of those,
Okay.
then that person qualifies for borderline personality disorder diagnosis, or
Okay.
potential of having borderline personality disorder is high.
Right.
And that requires a psychiatric test. Essentially, a qualified
Right.
psychologist should sort of diagnose and talk to the patient. Apart from these 9 symptoms, the family history matters also in terms of mental health conditions.
Okay.
Childhood matters because there is a high correlation between troubled childhood, as we call, or abusive childhood, and the person going on to develop symptoms which resemble borderline personality disorder.
Right. Okay. You also mentioned the word psychosis. I just want to make sure that, everybody understands what that means. So, if I'm not wrong, does it mean when the person is, losing touch with reality and is not aware of
That's correct.
doubting the situation and environment around them and not
That's
being
correct.
fully aware?
That's
Okay.
correct.
So,
Yes.
um, also, the NHS says that borderline personality disorder is the most frequently occurring,
Mhm.
personality disorder. Is there a way, like, is there a reason why? And, why is there such little information available about it, especially in India?
That's a very interesting question. So, borderline personality disorder remains a very stigmatized personality disorder, and that's also the reason why I feel that education about it is extremely important.
Yeah.
The stigmatization is primarily because of the behavioral emancipation of borderline personality disorder. There is a high overlap of other mental health conditions and comorbidities such as anxiety, depression, or even other personality disorders and borderline personality disorder.
Okay.
So it is difficult to diagnose it. How it emancipates is uncontrollable anger or what we call rage. Another
Right.
very
Right.
important symptom of borderline personality disorder, if I missed out saying this before, is consistently changing sense of self
Okay.
and identity. So, if I were to use some Hindi terminologies, it would be something like "पागल है, ये सन की है,
Yeah.
इसे खुद कौन है इसकी आइडिया नहीं है." These are the
Right.
kind of terms we typically hear about borderline
Right.
personality disorder. So, it also means is that the people with BPD might have a troubled relationship, including with their therapist.
Right.
Another important factor is while the prognosis or potential of recovery in borderline personality disorder is very high, typically, recovery takes time and it takes
Okay.
consistent efforts of both on the part of the patient himself and herself, or also on the part of the family members and near and dear ones. Given the overall time required, quite often what happens is the sort of tendency to give up and rather just call the person a bad
Yeah.
person is high, and
Right.
that collectively makes BPD a highly stigmatized mental health disorder. Not
Okay.
all BPD patients will switch to self harm. Having said
Right.
that, a particular subtype of BPD, there are four subtypes of borderline personality disorder, and it
Okay.
is also estimated that around 256 different emancipations of borderline personality disorder. So it
Right.
varies greatly from person to person, and symptoms such as self harm can
Right.
be perceived generally by people as attention seeking behavior
Yeah.
rather than being seen as something which is a genuine psychological problem that the
Right.
person is
Right.
dealing with. So
Yeah.
this collectively makes it a very sort of stigmatized personality disorder,
Yeah.
leading to
I,
a lot of. Sorry, yes.
no, I was saying I think that's also why, a lot of mental health issues, especially in India, are so stigmatized, not talked about, largely because the person feels that, people are going to look at them differently. They'll be
Yes.
judged for,
Yes.
talking about
Absolutely.
how they feel, and that's probably why there is such little information around it. But
Yes.
you mentioned that there are four subtypes of borderline personality disorder. So could you just tell us what those four subtypes are?
Sure. At the risk of people labeling themselves or self-diagnosis, I won't go into specifically describing the four subtypes, but what I can broadly tell is that
Yes.
how the subtypes differ is essentially how the borderline personality emancipates, which is how the
Right.
person behaves, right? So
Yes.
some people will switch to which is a quiet borderline personality disorder, for example. I'll just give you a couple of examples here.
Yeah, yeah,
A
sure.
quiet personality disorder, borderline personality disorder person won't go around causing harm to others, for example,
Okay.
but will take in a lot of trauma, turn in a lot of anger inwards.
Right.
And it will emancipate in self-harming, for example. Subtypes essentially differ largely based on how does the behavior emancipate. Nowadays, there are actually some diagnostic tools which help the person to understand which of the four subtypes they fall in. What we
Right.
need to be very sure about is that you don't need to qualify only for one subtype. You can
Okay.
qualify for a little bit of traits of all four subtypes.
Okay, understood.
Yeah.
So, speaking about this, maybe the different subtypes have different symptoms, but is
Mhm.
there a scale to the severity of people with borderline personality disorder experiencing these symptoms? Like, how would you, define these symptoms when they're only mildly represented in a patient versus someone who, suffers them
Right.
extremely?
Absolutely. In a therapeutic setup, it's absolutely possible to identify whether mild, moderate, or severe symptoms of BPD.
Okay.
Typically, how would you identify whether your symptoms are mild or moderate or severe are based on multiple factors, which are both internal as well as external. So, if
Okay.
you were to understand this, one important point is to say what is the level of impairment or dysfunctionality.
Okay.
It is seen that in borderline personality disorder, many people change jobs frequently or their job performance is affected severely because of this. So it's
Right.
almost like a disability, if we may call it.
Right.
So level of dysfunctionality really defines what is the level of sort of symptoms, whether it's mild, moderate, or intense. The other two, three ways to identify it is the interpersonal relationships, for example, or
Okay.
tendency to self harm. What is the frequency of those?
Right.
Another important and external factor is that what is the current quality of life of the person.
Right. Yeah.
That's another important factor to take into consideration. That whether the person considers herself or himself in a good place in life or no.
Okay.
The other important factor is what is the access to treatment. If the person is actively in treatment currently or not in treatment, that
Right.
also defines the severity of the symptoms.
Yeah.
So the scale per se doesn't exist. Having said that, in a diagnostic setup with a therapist, the person will be able to identify
Okay.
where they are in terms of their recovery journey, and
Right.
are they at a stage where they require intense treatment, much longer treatment,
Yeah.
or age is also, by the way, another factor.
Okay.
That some of the symptoms of borderline personality disorder tend to wither away with age. Let's say
Oh, okay.
impulsivity, for example. So impulsive decisions and impulsive behavior is
Right.
another very core symptom of BPD.
Okay.
And if you look at that tends to sort of go away as person ages. So the
Okay.
severity can also change based on the person's age and
Right.
where they
Right.
are in their life currently.
Okay, that's interesting to know. So my next question is more around, when you are an outsider looking at somebody with borderline personality, it's important to, give support to people. So, when someone is in a relationship or has a deep friendship with someone who does have borderline personality, what can they do to assist that person, when they're going through these phases of emotional instability? Are there things that we could do better to help support people who are struggling with this?
Oh, absolutely. That's a great question. I do feel that the society in general, but more importantly, the near and dear ones of the person who is diagnosed with borderline personality disorder can play a very fundamental role in their recovery.
Right.
Uh, First and the foremost is educating oneself. When the patient is diagnosed with borderline personality disorder, it's important that the family also familiarizes themselves with the symptoms of BPD and
Yes.
what part of the person's behavior is coming from their condition.
Right.
As you know, with any other mental health condition as well, the condition doesn't define the person completely. That's only
Yeah.
a part of them.
Yeah.
Just if I were to use a physical illness parallel, say for example, if somebody is diabetic, we
Yeah.
will say that the person has diabetes. That doesn't define the complete health of the person. So
Yeah.
it's the same in this case. So not labeling the person as a BPD person, but that the
Yeah.
person has a borderline personality disorder condition is
Right.
extremely important. Second is,
Okay.
as I said, educating themselves about the symptoms and understanding what are the stressors.
Yeah.
Because even if a person has borderline personality disorder as a condition, does not mean that they're consistently behaving erratically. There
Yeah.
are certain stressors, such as relationship stress, for example. In some cases, it could be financial stress. Some of
Yes.
these stressors particularly trigger some of the behaviors which we consider as borderline personality disorder behaviors. So,
Okay.
avoiding such stressors, avoiding such triggers is something that a family can do very well. The third one and most important is empathy and patience. I think that's something that can go a long way. In
Right.
a person who's living with borderline personality disorder can sometimes, out of symptoms or just the intensity of the symptoms, feel like this is a hopeless situation and
Right.
sort of a tendency to give up completely, not just on the treatment but also on
Yeah.
oneself, including self stigma, for example, is very
Right.
high. And in those cases, somebody just having a faith that you can do better and
Yeah.
encouraging the person that you will do better, even if it looks difficult today, you will continue keep getting better, is something extremely important. And that's where
Right.
the role of a family member and a partner or friends come
Yes.
in.
Of
Having
course.
said that, it's also important. I always emphasize that drawing clear boundaries is important, particularly when it comes to borderline personality disorder, because mental health, if you have a mental health condition,
Yeah.
you have to remember that your people around you also have their own mental health. And in
Yes.
that case, particularly for those who are not family members, or if the person is consistently getting into distress seeking behavior, which
Yeah.
is, let's say, or maladaptive behavioral patterns, such as, for example, addictions, or using addictions as or drugs as the only way to treat their condition because the symptoms can be intolerable sometimes. So,
Yeah.
switching to alcohol or some of the drugs is
Yeah.
very high in borderline personality disorder. In
Right.
such cases, seeking experts' help and helping the person to get out of such maladaptive behaviors is
Yeah.
also a role of the family member. Just
Right.
remember, given the condition that it is, a person who is living with with the condition may not always be in a position to make the right treatment choices or
Right. Right.
behavioral choices. So the
Right.
family members, particularly among the young population, the adolescents in young age is when you really diagnose PPD. You cannot diagnose it prior to that because the person is still developing as a
Right.
personality. But in the younger age, parents' role is actually very, very important in helping the person to seek the treatment and show
Right.
faith in them so that they can choose the healthy path.
Right. So, that is important. I think family support and the environment that you're in can really change the way that, your
Mhm, mhm.
treatment goes.
Or
So I,
even workplaces. If I may add,
yes,
even workplaces have an important role to play, and that's something I emphasize a lot on. That in an adult population, a person spends close to 40 to 50 hours, or even more sometimes, at work per week. And in
yes,
that case, it is impossible for the person to leave her symptoms back home and present
right,
as a normal quote unquote person at a workplace.
right,
And particularly with borderline personality disorder, it can be very, very difficult for the person to just suddenly switch to healthy behavior at a workplace. So, in that
yes,
case, adjusting the work to the working style of the person, A,
yeah,
identifying their strengths and playing to their strengths is extremely
yes,
important. Three
yes,
is some simple support. Let's say, for example, playing soothing music in the background can go a long way for the person with BPD to control their mood swings a little bit.
right,
So,
right,
allowing some of these small concessions at the workplace can also go a long way in helping BPD to cope up and
yeah,
also be productive.
that's
Remember
very
that
interesting.
people with BPD can actually do very, very well in a structured environment where there is some work that is given to them, there is a clear structure to it,
Right,
and many of them will actually sort of gain a lot from being in a productive sort of work place or staying
right,
productive because that feeds into their sense of confidence. And in
right,
fact, workplaces can be very, very, very useful in the recovery process.
yeah.
Hence, also at workplace, educating and creating an environment which is supportive to people with BPD is extremely important.
Yeah, that's so interesting that you say that. I think it's fascinating how, your environment can really change the way that you are, especially with someone like, with BPD, for example. As I mentioned before, there is very little information about, this disorder at all in India. So I think
Yes.
there is a limited amount of information out there about the treatment for something like this or the kinds of
Right. Yeah.
therapies that you would have to go through. So could you just explain to us, what are the therapies that are, what are patients
Sure.
usually treated with? What
Mhm.
therapies do they go through for borderline personality disorder?
Sure. So again, very important because therapy or psychotherapy
Yeah.
is the frontline treatment for borderline personality disorder.
Right.
So as we know, for many mental health conditions such as depression, anxiety, there is proven medication that's available.
Yeah.
If it is taken along with therapy, it turns
Right.
out to be quite effective. Whereas when it comes to borderline personality disorder, there isn't a particular medication that helps. Hence, therapy remains the main option for the people who have a borderline personality disorder
Okay.
diagnosis.
Okay.
Within the therapies, dialectical behavioral therapy is the frontline treatment or was considered as the frontline treatment until recently. So, dialectical behavioral therapy, which is based on cognitive behavioral therapy, is really the frontline treatment that's available.
Okay.
Apart from that, mentalization based therapy, schema based therapy, transference focused therapy are some
Right.
of the other therapies which have emerged in the last few years. The effectiveness of all of those is to a varying degree is great. Having said that, in India, I am personally not aware of that many therapists who specifically
Right.
specialize in treating borderline personality disorder.
Right.
Some of these treatments are also done in a group setup. So there are some support groups that are now emerging in Bangalore and Delhi. So
Yes.
it's possible that you can just be a part of some of these support groups and take treatment in through that.
Right.
That along with the therapy that you would take, medication to a limited extent can play a role,
Okay.
particularly because of the comorbidities, essentially depression, anxiety, and
Right.
even mood swings, which is another very, very important sort of part of borderline personality disorder. And mood
Right.
swings in general population are very different from borderline personality disorder mood swings.
Right.
I'm
Right.
just going to sort of deviate a little bit and talk a little bit about this because it actually also is very important in terms of we experience change of mood maybe
Okay.
a couple of times in a week. Something happens, our mood changes. Something great happens, our mood changes. Something not
Yes.
so great happens, our mood changes. A
Yes.
person with borderline personality disorder her moods can change practically every minute,
Oh wow.
uh,
Okay.
within a day's time.
Yeah.
And sometimes a depressive episode or an anxiety episode can last from hours to days together.
Oh
Uh,
wow.
and mood swings not just include mood swings, but also changing sense of identity. Who am
Okay.
I as a person?
Right.
What,
Right.
including even what is my religion? A
Right.
person might have a very different view of that based on how she or he is feeling. So
Right.
that's important to remember. So some of
Wow.
these conditions are aggravated by, let's say, addictions, drugs, not having adequate sleep, for
Right.
example, not exercising enough. So as much as therapy, so some of these things, uh, a mild antipsychotic drugs are also used by therapists. It's not unheard
Right.
of. So
Right.
typical SSRI, SNRIs are the ones which we use typically for anxiety and depression. Along with that, some mood stabilizers can also be used in medication. Having
Right.
said that, there isn't any FDA approved drug in the US at least yet to treat
Right.
specifically borderline personality disorder. Now, the
Right.
third part, which is the therapy, medication, along with that, which I had just started referring to in this answer,
Yeah.
is lifestyle changes.
Right.
Extremely
Right.
important. So
Yeah.
something as simple as exercise is very, very important. Regular
Yeah.
rigorous exercise can control a lot of your symptoms, particularly mood swings, anxiety can be controlled, and this is
Yes.
important especially for patients who live with borderline personality disorder.
Right.
Getting adequate sleep every day is extremely important.
Yeah.
Following a structure can go a long way. Structure, as in following a certain routine and having certain lots of unplanned time,
Right.
would mean that then you're letting your symptoms to play out.
Right.
So it's
Right.
very important to have your some structure to your day, and it can go a long way in helping the person with borderline personality disorder. Along with that, some of the other healthy eating is important. There is a strong correlation between how you eat and how you feel, especially in the context of borderline personality disorder again. So having healthy eating patterns and getting the right amount of vitamins is extremely important. So with
Okay.
the combination of these three, you can and certainly feel better and have a great hold over your condition.
Right, right. No, thank you for that explanation. I think I had no idea that there were, three different methods used to treat this. Which brings me to my, final question, which is once a person starts, their treatment for borderline personality, what does their recovery journey typically look like? How long would you say somebody would have to be in therapy, on average, or, what is their recovery journey?
So, of course, Navya, there isn't any set period for recovery, of course. And
Right,
the second is, as any other mental health condition, recovery is not linear.
right,
You
right,
would sometimes switch back to your behavior, or symptoms will play out. Sometimes you will feel better and you will not have any symptoms for a while, etc. So,
right.
recovery remains non linear and there isn't a set period. As I said, in general, because it's a personality disorder, we have to first understand that there is no cure per se to borderline personality disorder.
Yeah.
What does recovery look like? You learn to manage your symptoms very well. Some
Yes.
of the feelings or some of the thought patterns are so hardwired in the brain, and in
Right.
particularly in a condition like BPD, some parts of your brain are, particularly the frontal part of your brain and the amygdala, is actually affected. So some
Right.
of these things don't go away, but you learn to manage the symptoms better. And the first step to that is educating yourself and being aware of your symptoms. So
Right.
that's the
Right.
first stage of your recovery. The moment you realize that your symptoms are hampering the quality of your life and also the
Yeah.
quality of life of others around you, then
Right.
seeking treatment and educating yourself about BPD is really the first step of recovery. After
Okay.
that, staying in the therapy and doing the three things that I just mentioned about, out of
Yeah.
which medication is something will only come from an expert and a psychiatrist
Right.
if required. But if not, at least being in the therapy consistently and working on your behavior and thought patterns is important.
Yes. Yes.
And in fact, the manuals or the workbooks that I talked about
Yeah.
exactly do that. Say, for example, dialectical behavioral therapy takes four aspects of BPD, essentially
Yes.
the interpersonal relationship, distress tolerance,
Right.
impulsivity, and mindfulness as the four areas,
Right.
and consistently helps you replace your maladaptive behaviors or thinking patterns with more healthy and adaptive sort of thinking patterns and behaviors. And
Right.
some of these, as you can understand, it's about changing the behavior, can be a long term process. Having
Yes.
said that, you do go from strength to strength once you get sort of some hold over the sort of
Right.
exercises and activities you need to do. And in some cases, in a few years' time, you will actually not meet the diagnostic criteria of BPD. So that's how the
Right.
recovery looks like. So you can go from very high symptom presence to very little symptom presence, and great
Right.
hold over your behavior and thinking patterns is how really the
Right.
recovery looks like.
Thank you so much for that. And, thank you again for taking the time out to speak to us about this and, giving us so much valuable information about this disorder. But thank you so much once again, Mr. Joshi, for speaking to us today.
Thanks,
Um,
Navya.